The invitation arrived while I was in physical therapy. Dr. Rebecca Foster will deliver the keynote address at the State Medical Conference. Excellence in Surgical Innovation. Friday, March 15, 2 p.m. I stared at the card, sweat dripping as I gripped the parallel bars and forced my legs to move. 3 weeks after my 6th spinal fusion surgery. A 12-hour operation to correct complications from previous surgeries. Bad news. My physical therapist Maria asked. My sister's giving a keynote speech. About surgical excellence. That's nice. Are you going? She's a neurosurgeon. I've had 6 spinal surgeries in 3 years. She's called every single one unnecessary. Maria's expression shifted. Your sister's a neurosurgeon and she thinks your surgeries were unnecessary? She thinks I'm doctor shopping for attention. At 33 I was 2 years older than Rebecca, but you'd never know it. Rebecca was the golden child. Neurosurgeon at Northwestern Medical, published researcher, rising star. My parents bragged about her constantly. I was the disappointment. The former lawyer, who'd quit practicing 3 years ago when degenerative disc disease progressed so rapidly I could no longer sit through depositions. Now I did legal consulting from home between surgeries. Megan's back is just weak, my mother said. She needs to exercise more. Surgery is overprescribed, Rebecca declared. Most back pain is psychosomatic. Megan's probably just stressed. What Rebecca didn't know was what I actually did. I wasn't just doing random legal consulting. I was the senior legal advisor for the state medical board. I reviewed physician discipline cases, investigated complaints, and advised the board on licensing decisions. 3 months ago, a complaint had been filed against Rebecca. A patient reported that Rebecca dismissed her escalating back pain as normal post-surgical discomfort after a lumbar fusion. Rebecca refused follow-up imaging and told the patient to toughen up. The patient's fusion had failed completely, leaving her partially paralyzed. Emergency surgery by another surgeon saved her from complete paralysis, but she'd lost function in her left leg. The complaint crossed my desk. I'd immediately disclosed the family relationship and recused myself. But I'd seen the file. 5 similar complaints. Patients whose complications Rebecca dismissed as weakness or psychological. 3 suffered permanent damage from delayed treatment. Rebecca didn't know I worked for the medical board. She thought I did boring legal paperwork. She definitely didn't know her license was under review, or that her hearing was scheduled for Monday, March 18th, 3 days after her keynote speech. Hold up. Friday morning, I forced myself into professional clothes that hung loose on my surgery-affected frame. The incision was still healing, a 6-inch line down my lower back. Every movement hurt. Maria had said I shouldn't go. 3 weeks post-op is too soon. I need to see this. I drove to the convention center, every bump sending pain shooting down my spine. The auditorium was packed, 300 physicians. Rebecca was the keynote speaker everyone wanted to hear. I found a seat in the back row. My parents were in the front, beaming. The conference director introduced her. Dr. Rebecca Foster has revolutionized spinal surgery approaches. She's published 43 papers, holds 2 patents, and at just 31, she's the youngest neurosurgeon to receive the Surgical Innovation Award. Rebecca walked to the podium, confident and polished. Thank you. I'm honored to speak about surgical excellence. As surgeons, we hold patients' lives in our hands. We make decisions that determine outcomes. And we must have the judgment to know when surgery is necessary and when it's not. She clicked to her first slide. One of the biggest challenges is patient pressure for unnecessary procedures. Patients come demanding surgery for pain that can be managed conservatively. They doctor shop seeking the surgeon who will say yes. Some surgeons are too quick to operate. My stomach tightened. I've built my practice on saying no when surgery isn't indicated. On telling patients that physical therapy and lifestyle changes can address pain without surgical risks. Yes, some patients get angry. Some call me dismissive. But I'd rather have an angry patient than one who underwent unnecessary surgery. The audience nodded approvingly. I see this in my own family, Rebecca continued. My sister has had 6 spinal surgeries in 3 years. 6 operations because she refuses conservative management. She doctor shops until she finds surgeons who will operate. Then she calls me cruel for suggesting physical therapy first. The audience shifted uncomfortably. My sister is the perfect example of a patient addicted to surgery. She's convinced every ache is an emergency. She exaggerates pain to manipulate doctors. She's had so many surgeries that she's created a cycle of complications that wouldn't exist if she'd just done physical therapy from the start. My father nodded. My mother had tears of pride. We have to resist this pressure. We have to be the voice of reason. We have to tell patients no even when they're family. Because surgical excellence means knowing when not to operate. A man in the third row stood. Dr. Robert Martinez, president of the state medical board. The person who would preside over Rebecca's hearing Monday. He started walking toward the stage. Revelation. Dr. Martinez reached the podium. Dr. Foster, I'm Robert Martinez, president of the state medical board. May I interrupt? Rebecca's smile faltered. Dr. Martinez. Of course. You stated your sister has had 6 unnecessary spinal surgeries. Are you familiar with her medical records? She's told me about the surgeries. Have you reviewed her imaging? Her surgical reports? Her pathology results? I don't need to review records to know that 6 surgeries in 3 years is excessive. That's doctor shopping. Or it's a patient with severe disease who's had complications requiring revisions. Without reviewing records, how can you make that determination? I'm her sister. I know her. She's always been dramatic about pain. You're also a neurosurgeon publicly stating that another neurosurgeon's patient, your sister, received unnecessary surgeries. That's a serious allegation. Dr. Martinez pulled out his phone. I have your sister's surgical records, with her permission. Would you like me to read them? That's not necessary. Dr. Megan Foster. Initial diagnosis. Severe degenerative disc disease, L3S1. 3 herniated discs with nerve compression. Conservative treatment attempted 8 months. Physical therapy, epidurals, nerve blocks. All failed. First surgery, L4-L5 fusion. Complication, adjacent segment disease. Second surgery, extension to L3. Complication, pseudoarthrosis, fusion failure. Third surgery, revision fusion with bone grafting. Complication, hardware failure. Fourth surgery, hardware removal and replacement. Complication, infection requiring 6 weeks for antibiotics. Fifth surgery, debridement and new fusion. Sixth surgery, revision of entire construct due to progressive collapse. The audience was silent. Rebecca stood frozen. 6 surgeries, not because your sister is addicted to surgery, but because she has severe disease that keeps failing surgical repair. None were elective. All were medically necessary. You as a neurosurgeon should know the difference. I didn't realize, Rebecca began. You didn't ask, Dr. Martinez said. You didn't look at her records. You assumed she was dramatic. And you humiliated her at a medical conference. He paused. Are you aware your license review hearing is Monday? Rebecca went pale. That's confidential. It was, he said, until you proved exactly what your patients complain about. Dismissing real symptoms, refusing imaging, telling suffering patients it's in their head. He faced the audience. Dr. Foster has 5 formal complaints. Same pattern every time, ignoring worsening symptoms after surgery. The conference director tried to intervene. Let's handle this privately. No, Dr. Martinez said. She made it public when she mocked a patient, her sister, during a keynote speech. He turned back to Rebecca. One of your patients had severe pain after a fusion. You told her to toughen up. Her fusion completely failed. She's now partially paralyzed because you delayed imaging for 3 months. Rebecca's voice cracked. I didn't think. You didn't think her pain was real, he said. Just like your sister's. He handed her a document. Your hearing is now an emergency session. Monday. 9 a.m. Bring proof you can safely practice. Rebecca whispered, You can't do this. You did this, Dr. Martinez said. He looked at me. Miss Foster, I'm sorry. Your records show severe disease. Every surgery you had was necessary. 300 doctors turned to stare at me. My parents' proud smiles collapsed into shock. I stood, pain shooting down my leg, and walked out. Resolution. The emergency hearing happened Monday. I wasn't allowed to sit on the panel, but I heard the outcome. Dr. Martinez presented every complaint. Rebecca's own keynote speech was submitted as evidence. Her medical license was suspended for 1 year. She must complete remedial training and work under supervision after reinstatement. Her hospital suspended her privileges immediately. The story went viral. Neurosurgeon mocks sister's surgeries, gets license suspended. My parents called. Why didn't you protect her? They demanded. Protect her from what? I asked. From hurting patients? From calling my disease fake. She made a mistake. She meant every word. She's been calling me dramatic for years. She mocked me publicly while I'm held together with titanium. If you don't help her, you're not part of this family, my father said. I haven't been part of this family since you decided my pain wasn't real, I replied and hung up. My surgical records were used, with my permission, to show the truth. Dr. Martinez wrote, Ms. Foster is not addicted to surgery. She is a patient with severe disease who deserved compassion. 6 months later, I needed surgery number 7. A new surgeon, someone who actually believed me, performed it. This time the fusion held. Physical therapy was awful, but I got stronger. For the first time in years, I healed. Rebecca completed remedial training but never returned to Northwestern. Too many colleagues had seen the speech. She took a position at a small hospital in another state under supervision. We haven't spoken. My parents blame me and cut off contact. 1 year after the conference, the medical board asked me to develop training materials for physicians. I used my case, anonymized, as an example. This patient had 6 surgeries in 3 years. A dismissive physician might see doctor shopping. A competent physician recognizes severe disease requiring multiple interventions. The materials were distributed to every medical school in the state. Rebecca's speech was used as a teaching example of what not to do. 2 years later, my fusion remains stable. I'm back working full-time, now as Director of Physician Standards. I've overseen disciplinary actions against 12 physicians with the same dismissive pattern. I still have chronic pain. But I have compassionate doctors now. Surgeons who believe me, who understand that complex cases require patience and empathy. Rebecca's career never recovered. Her license was reinstated, but her reputation was destroyed. No patient wanted a surgeon who'd publicly mocked her sister's pain. I don't regret what happened. Rebecca chose arrogance over compassion. She chose to publicly humiliate her sister. She chose to dismiss patient suffering. And the medical board chose to protect patients from physicians like her. Some surgeries are unnecessary. Mine weren't. And physicians who can't tell the difference shouldn't be operating on anyone.